Now is the Texas Republican Congressman Michael Burgess, a doctor from North Texas. He'll be part of a House hearing on the Ebola outbreak on Thursday. Congressman, welcome to the program.
Well, thanks so much for having me on.
This is clearly a very important shift now from the CDC and from the White House. Rather than saying, look, we've got this thing covered, a more constructive phase where they admit that the protocols may not be transmitted on the ground as they had hoped. What can you do in this constructive phase as a committee to further strengthen the resolve here?
Well, I think one thing that everyone has learned over the last 6 weeks is to have a great deal of humility in your approach to this illness. Look, I believe if someone involved in research wants to study the virus, they have to go to one of 4 very specialized labs in order to do this. But you can go to apparently any hospital and take care of it? I don't think so. I think once the patient is identified and stabilized, they do need to be transferred to a specialty facility that will provide the care, where the personnel have the training necessary to provide the care and not endanger other people or themselves.
That may be your recommendation as a medical doctor, but that's not the system, is it, sir?
No, it's not. And yeah, I've spoken to people offline about this. I do believe, I'll be honest with you, I think the thinking is evolving as new information comes forward. But clearly, the days from the early part of September where we got this one in hand to where we are now in the middle of October, it's a different situation. But don't forget, people were telling us in mid-March and mid-April that this disease would burn itself out in Western Africa. It would never reach the proportions that it has over the last 6 months. So I think all of us are learning a lot about this illness with the passage of time.
Well, given that officials in this country have totally underestimated this and that there have been mistakes made, you alluded to this, but how underprepared are U.S. hospitals for this, with now a nurse contracting it from a patient and other healthcare workers in the country concerned?
Well, last summer I had some discussions with the CDC, and it was pretty obvious then that the virus, of course, has a very high mortality rate, is 50 or 60%, but 10 or 15% of those deaths were amongst healthcare workers. So there was a real vulnerability. But you look at the experience of a group like Doctors Without Borders and the almost ritualistic or militaristic way they go about preparing to go in and take care of the patient and then depart from that environment. There is a lot to be learned there. Some of the emails I've seen is that people say we're exposed to almost toxic levels of chlorine while disrobing after coming out of a patient care environment. You know, the average anteroom of the ICU of a hospital in the United States is not prepared to deal with that level of decontamination.
You mentioned Doctors Without Borders, or Médecins Sans Frontières, who are working in West Africa. Mark Zuckerberg is just getting himself some headlines because he's donated $25 million to the CDC Foundation in this country. If people are concerned about this and they want to help, are they better, in your view, donating to the CDC Foundation or Médecins Sans Frontières, Doctors Without Borders?
You know, I'm not qualified to provide that level of discernment. I welcome Mr. Zuckerberg's donation. I hope others will follow his lead, but Doctors Without Borders is also an excellent group and certainly worthy of people's support.
The point I was going to make was, one is obviously operating in a different field as the origin of the virus from here. Let me ask you one final question, sir, which is, and you can help us here with the involvement and the cost of what is going on in hospitals. I read that the missionary, Kent Brantley, had 26 medical staff caring for him. They were pumping 5 to 10 liters of fluid into him every day. Who is going to pay for the level of reaction from the hospitals and for their potential liability if one of their staff gets sick and they then sue the hospital on the basis that the hospital hadn't properly prepared them? Where does the cost for this and the liability for it end up?
Well, those are 2 separate areas, the cost and the liability, but the answer to both of those right now is not knowable. You're in the phase of fighting this right now. It has to be fought. The challenge has to be met. I think there are things that can be done that mitigate some of the dangers. I do think, I'm one of those who thinks that visas for people traveling from Western Africa, right now we need to put a pause on that Clearly, things were not as we were told at the 1st of September by the federal agencies responsible for preparing our hospitals. We need to put things on pause for a period of a few weeks and allow ourselves to catch up.
We'll watch what you do with the committee on Thursday with great interest, Congressman. Thank you for joining us there. Dr. Michael Burgess joining us on Ebola.
Thank you.